is Your Health Matters. We're at Belton Regional Medical Center with oncologist Dr. Kelly Young. Thank you so much for talking to us today.
Thank you for having me.
So October is Breast Cancer Awareness Month. What are the big risk factors that you want more people to know about as far as breast cancer risks are concerned?
Well, the risk factors I like to focus on are the modifiable risk factors, the things that you can be empowered to do something about.
Yeah.
Being overweight or obese is an independent risk factor for breast cancer, as well as being sedentary. Alcohol use is its own independent risk factor for breast cancer. The more alcohol exposure, the higher the risk for breast cancer.
Do you feel like people don't know that? Do you feel like that's something that surprises a lot of people with the alcohol use thing?
It does surprise a lot of people. There are more times in my clinic that I bring that up and people realize that it's an easy change to make.
Absolutely.
And other risk factors that are non-modifiable, like your age, your gender, and your family history, are important in discussions with your provider about your breast health, but not as actionable.
Those things that you can change are the big part of it.
Exactly.
The other thing we want to talk about today, we're standing here in front of a mammography machine. We want to talk about a lot of the myths necessarily. There are 3 things that you wish more women would know about this machine, about this procedure. What are those top 3 things you wish more people knew?
The top 3 things I want people to know are that, number 1, every woman should get mammograms. They are a very key component of your long-term health. Number 2, mammograms are not painful. There can be some mild discomfort as your breast tissue is on the machine, but it's quick and simple and painless. And number 3, for women at average risk, breast cancer screening with mammogram should start at age 40 and continue every other year thereafter. There are some women that may be at higher risk, and they should talk with their primary provider about any changes in the start date or the frequency of mammograms for them.
40 years old, not an option, and they don't hurt as much as you think they're going to hurt. Those are the big things you want people to know.
Exactly.
Dr. Young, that was excellent. Thank you very, very much.
Thank you.
For Your Health Matters, I'm Taylor Jimenez, 41 Action News.